Hi, this is Jo Bailey, and this is a 4-part series of looking at the most common mental health misdiagnoses in children. Today, in part 1, we are going to look at what is commonly diagnosed as ADHD and what other things it could be. In the following videos, we're going to look at depression, anxiety, and ODD, which is oppositional defiant disorder. These 4 conditions comprise 4 of the most commonly misdiagnosed conditions that I see in children. If your child fell down and hurt their arm badly, you'd probably take them to the hospital, to a doctor, and get some x-rays. The images are going to help the doctor diagnose whether or not the arm is broken and is going to guide the treatment plan. A broken bone, well, perhaps 6 weeks in a cast. If it's a sprain, more likely the RICE protocol, so rest, ice, compression and elevation. But without these x-rays, your doctor won't know whether or not the bone was broken and if they made the wrong guess or not. And that could potentially lead to prolonged pain for your child or a bone that doesn't heal correctly and cause problems in the future. So why are mental health and behavioural health problems treated differently? In traditional psychiatry and mental health, we typically never look at the organ that we treat, the brain. This means psychiatrists and psychologists are guessing when they're making a diagnosis based solely on symptoms that the parent is reporting or the child is exhibiting in that moment in time. So this results in many children being misdiagnosed and treated with the wrong plan. And that can lead to unnecessary suffering. It also means that one professional's guess may be different from another professional's guess, leaving the child and the family with a whole bunch of labels that are also very unhelpful and don't inform the correct treatment. There are clinics such as the Amen Clinic in the States which uses brain SPECT imaging as part of their complete evaluation. They look at the brains of the patient and they're not relying on guesswork. Based on tens of thousands of patients and referring to their research, I have put together this video series to look at 4 of the most common misdiagnoses in children. So let's look at ADHD, and the primary symptom here is inattention. Inattention is one of the classic symptoms of ADHD. So when a child has trouble focusing, is easily distracted, or frequently daydreams, parents and clinicians are often suspecting that it's due to this common condition called attention deficit hyperactivity disorder. But not all inattention is due to ADHD. There are often other causes, and often these are quite prevalent and frequent and commonly misdiagnosed. So I'm going to run you through 10 other causes of inattention to ensure that your diagnosis is correct. So if your clinician or professional hasn't ruled out or considered these other causes of inattention, then you may be one of these people who have an incorrect diagnosis. So let's go through these now. Number 1, poor sleep. Inadequate sleep can make it really hard for children or teens or adults to pay attention. A single night of tossing and turning and not sleeping well can impair one's ability to concentrate. So up to 50% of children are going to experience a sleep problem. So we need to be looking at sleep and considering if sleep is one of the contributing factors to that attention deficit behavior. Number 2, distressing life events. So I'd see this all the time in my clinic. They bring the child in for behavioural problems, and yet in the background there's all these biopsychosocial problems. So parents might be divorcing or separating or fighting. The child may have lost a pet. Their best friend might have moved away. And all these things can take an emotional toll on a child and lead to distractibility and inattention. Number 3 is food sensitivities. I'm always screening for a really comprehensive understanding of what the child is consuming on a daily basis. So foods like gluten, dairy, corn, soy, and artificial dyes and preservatives can cause issues with focus and attention in some children. So if you have not provided a really thorough description of your child's eating behaviours, then your diagnostic assessment was potentially lacking. Number 4, anxiety. Many kids are experiencing anxiety. Many people are experiencing anxiety. Up to 1 in 4 at any given time may have symptoms of some form of anxiety. For a child, they may be so wrapped up in their anxious thoughts or in feeling uncomfortable or distracted by the cognitive and physiological symptoms of their anxiety that they're unable to focus. And then this is manifest through behaviours that appear to be inattentive and hyperactive. Number 5, obsessive compulsive disorder. So children with OCD are often so distracted by their obsessive thoughts and compulsions that they aren't able to pay attention in school or at home. So OCD needs to be ruled out before a diagnosis of ADHD can be provided. Number 6, post-traumatic stress disorder or PTSD. So children who have experienced trauma and who have developed PTSD may be subject to intrusive thoughts or memories about the event. And that pulls their attention away from the present moment and renders them incapable of focusing and paying attention in places like the classroom or at home. If a child has trauma in their history, then that would be my focus before considering a diagnosis of ADHD. Number 7 is learning disorder. Kids who look like they're not focusing or who can't seem to concentrate on the subject or the books that are assigned to them in school may have underlying learning disabilities. If you suspect this, then it's probably essential that your child undertake some type of cognitive psychometric test just to be sure that we're not dealing with an underlying learning problem. Number 8, head injuries. One of the most important lessons from 160,000 brain scans at the AMEN clinics is that mild traumatic brain injury, what we call TBIs, can cause psychiatric problems. But few people know about this and few professionals are screening for this. Inattention is a common symptom in children who have experienced concussions, multiple concussions, or other head traumas. Number 9, Irlen syndrome. Irlen syndrome is a visual processing problem where certain colours of the light spectrum irritate the brain. And it runs in families and it's common after a TBI, a traumatic brain injury. Any child experiencing symptoms of decreased concentration should be screened for this. And number 10 is exposure to environmental toxins. Simply being exposed to everyday chemicals, to mold or other toxins can cause inattention. So ensuring that the environment is a healthy one and free from the damaging effects of neurotoxins. If your child has been given an ADHD diagnosis and your professional hasn't gone through those 10 areas and ruled out other contributing factors, then you may want to seek a second opinion. Before giving your child a strong medication such as Ritalin or Concerta, please ensure a thorough investigative assessment has been conducted. If you would like more information or set up an appointment with myself, you can contact me at Healthwise in Queensland, and the website address is on the screen now. Join me in video 2 of this series where we'll look at the symptoms of sadness, negativity and fatigue, which are commonly diagnosed or misdiagnosed as depression. Until then, take care of yourselves and each other and have a very happy, peace-filled day. Bye.